Now we start scanning by using convex probe, placing it in transverse position at epigastrium area. Here we see the left lobe of liver. The left lobe of liver shows normal homogeneous texture, no mass or lesion seen. Here we see the duodenum, which lies at left side of the left lobe of liver. Here we see echogenic lining. These are gases in the duodenum. Also we see shadows of these gases, and here we see the food particles. The duodenum walls are normal and not visualized. The walls of duodenum are only visible when they are inflamed. This is aorta and this is vertebral body. The cortex of bone appear as echogenic line. Now below left lobe of liver we see the pancreas. The body of pancreas and tail shows homogeneous texture, no mass or lesion seen. Here we see the confluence of portosplenic vein. This is aorta, and here we see the splenic vein. Pancreas is lies along the splenic vein, and unsnared process head and neck are along the portosplenic confluence. So when there is excessive gas shadows, it is easy to locate the pancreas. First you find out the portosplenic confluence and splenic vein. Then you can find out the pancreas. Now when we focus the unsnared process and head of pancreas, we see that the size is increased but has homogeneous texture. The wall of unsnared process and body of pancreas irregular hair, and surrounding tissue shows increased echogenicity, which shows inflammation here. The structure of pancreas shows abnormal appearance here. Now when we rotating a probe in oblique position, we see an irregular wall mass arising from the unsnared process and head of pancreas, which is isoequic, having same structure as pancreas. Now we will measure the size of mass of pancreas. The size of mass of pancreas is 31.9 into 27 millimeter. Now in color Doppler we see internal flow in the mass of pancreas. The body and tail of pancreas shows normal homogeneous structure and no pancreatic duct seen. Now we will scan the liver to see any pathology or focal lesion. This is portal vein which appears to be normal. The size of portal vein is 10.7 millimeter. The normal size of portal vein is up to 13 millimeter. Now we will measure the common bile duct, which is necessary to scan because we should know whether the pancreatic mass causing obstruction or not in the common bile duct. The size of common bile duct is 2.2 millimeter, which is normal, and causing no obstruction. The normal size of common bile duct is up to 6 millimeter. Now how we will write report?